We will talk about dementia. Dementia is decline in normal mental function, and it's interfere with normal life. It's important that dementia decreases quality of life. In case of normal aging, when people get old, their mental abilities also decline. But in case of dementia, it's more severe than expected in normal aging. So dementia is severe form of age-related decline in mental function, and it affects memory, thinking, orientation, calculation, learning, judgment. And dementia is not single disease, it's complex of symptoms, which is called syndrome. So dementia is syndrome, and main characteristic of dementia is decline in mental functions. Dementia is very difficult for person because it decreases quality of life, and it's very difficult for primary caregivers and family members also, because it's very challenging when person in your family has dementia. It's very difficult. Dementia affects around 10% of world population after 65. So dementia is strongly correlated with aging. Almost always dementia develops during aging. It's very important. And most common cause of dementia is Alzheimer's disease. It's responsible around 70% of cases of dementia. So when we say dementia, almost always we mean Alzheimer's disease. Almost always when we say dementia, we mean Alzheimer's disease, because it's responsible on 70% of cases. What is Alzheimer's disease? It's cognitive impairment. Cognitive functions are impaired over time. It's progressive disorder, and protein amyloid is deposited in the brain, and it damages brain. It's important characteristics, and we have amyloid deposition in the brain in case of Alzheimer's disease, and it's progressive and it's irreversible, and it directly affects person's lifespan. People with dementia live less longer compared to ordinary general population, around minus 10 years, sometimes minus 14 years than expected. So Alzheimer's disease affects our judgment, our cognitive abilities, our memory, but also affects our lifespan. That's why it's important. And how Alzheimer's disease begins? It begins difficulty remembering recent events. It's first signs of Alzheimer's disease, and the symptoms progresses, and symptoms becomes very severe after 7 years. Around 7 years, sometimes more, sometimes less, but averagely after 7 years, it progresses and becomes very severe. And Alzheimer's disease is very strongly related to aging. It has some genetical, environmental factors, but very strongly and dramatically related to aging, because, for example, person with you can find almost 10% of people with dementia and Alzheimer's disease when person is around 70 years old. But if person is 90 years old, this number increases dramatically, maybe triple, maybe increase 4 times. So dementia and Alzheimer's disease especially is very strongly related to aging. And what is treatment? Treatment of dementia, and in this case Alzheimer's disease, is acetylcholinesterase inhibitors. But here is problem because we have no cure, and these acetylcholine inhibitors, acetylcholine is main neurotransmitter which is important for cognition, for memory, but even with treatment only we have 6 to 12 months slow down of cognitive impairment, and it can increase lifespan around 6 months. So it's, and only 50% of patient will have a positive reaction on this treatment. So we can say that we have no effective treatment. We can get only 6 months, around 6 months, which is not enough, of course. So brain damage is irreversible, and we have this amyloid plaques. You can see this is amyloid plaques, this is neurons, and it directly affects person's lifespan, minus 10 years average. So Alzheimer's disease is most important disease when we're talking about dementia. Second most important disease is vascular dementia. It's type of dementia when we have problem in blood vessels. So when person has stroke or mini stroke, its vascular supply of brain is diminished, and it causes dementia. And this dementia is different. What means? Symptoms fluctuate. Here is most important part to say. Symptoms fluctuate. Person has good days and bad days. Person can feel good in some days, good memory, good thinking ability, but some days he is wired. He has some problems with thinking, with reasoning, with remembering things. If the symptoms fluctuate, it's strongly related with stroke. It's related with hypertension, with high cholesterol level, and even mental clarity can change throughout the day. It's important characteristic of vascular dementia. Vascular dementia is responsible on 10 to 15% of dementia cases. And person can have other symptoms, additional symptoms like paralysis, for example, facial asymmetry, for example, weakness, speech problems, and restricted blood flow in the brain. And what is treatment? We have no direct treatment here, but controlling hypertension is very important. Also, cholesterol control is very important, diet, exercise. And we should say that vascular dementia also affects lifespan. In many cases, people live around 5 years after vascular dementia symptoms, but we can have also very good prognosis in some cases. So it highly dependent on brain condition and this blood flow restriction. And if person controls hypertension, if person controls cholesterol level, diets, and exercise, in many cases this vascular dementia and brain damage is slowed down for many years. So person can live with vascular dementia if it's well managed and if brain damage is not big enough. That's important point. And third type of dementia is Lewy Body Dementia, LBD. It's responsible around 10% of cases of dementia. And at this case, we also have deposition of proteins in the brain, but they called these proteins called Lewy bodies. And this Lewy body deposition also destructs brain structure and affects our cognitive ability. Here also cognitive ability and cognitive functions fluctuates. It's important. And another characteristic of Lewy body dementia is visual hallucinations. person can see some structures, some grids, some lines on the wall, for example. Maybe he sees objects smaller than they are reality, or larger compared to reality. It's visual hallucinations. Person can have visual hallucinations, and if he has visual hallucinations, it indicates Lewy body dementia, because visual hallucinations is strongly related to Lewy body dementia. It's also progressive disease. It also decreases lifespan. Also, we have no treatment. So prognosis here is not also very favorable. We have acetylcholinesterase inhibitors here also, but treatment is not very effective. It's also related to destruction and progressive loss of neurons. So we have these three most common causes dementia. First and most important is Alzheimer's disease, second is vascular dementia, and third is Lewy body dementia. That's all I wanted to say. Thank you for your interest. Thank you for your watching. If you like my videos, please thumbs up. If you like my channel, please subscribe. Thank you very much. Bye for now.